Dr. Jose Perez, Chief Medical Officer at the South Central Family Health Center in Los Angeles, is with us now. Dr. Perez, thank you for being with us. Just quickly, we're hearing from a lot of medical workers, healthcare workers, basically this pessimism. There was this hope earlier in the year, there was sort of maybe this is getting under control, but right now there just seems to be almost a lack of hope that this country will get through this winter without being a mass casualty event. What's it like for you?
Thank you for having me. At South Central Family Health Center, we're in South LA, and our community is predominantly Hispanic, Latino working families. And we are experiencing the same surge that all of the other areas of LA is doing. It's hard. It's hard for our population because they are the frontline workers. They are the cooks. They are the people that clean houses, and many of them must work, and they know that they go out into the world knowing that they're putting themselves at risk, but they know that if they don't work, they won't be able to eat. South Central Family Health, absolutely. We have what we call the social determinants of health, and those includes poverty, overcrowding. The area where South Central is located is the most densely populated area of LA County as a whole. We are experiencing 14% of our patients that get tested are coming back positive, and many of them are even some of our workers. 2/3 of our staff are folks from the community themselves. So they get the double whammy. They get their family members who work in the area, and they themselves have to come to work. And I cannot emphasize enough the stress that this is causing, the behavioral health issues that our staff deals with on an everyday basis. And yet I am proud of my staff. I am proud of my nurses, my medical assistants, and my providers, because they show up every day. Yeah. We haven't closed our doors, and we will continue to support the hospitals.
The headline from the San Diego Union Tribune on Tuesday seemed fairly ominous. Healthcare rationing on the horizon if hospital surge continues. Rationing of healthcare is something that many of your patients already know a lot about. They're mostly lower-income families. They often don't have health insurance. How are they now being impacted by this surge of new infections, just in terms of access to treatment? How is it different for them, I guess, than other families across the United States?
Again, it outlines the disparities in access to healthcare by different populations in the United States. We take care at the community health centers. We take care of the most vulnerable, and they very often don't have insurance or have minimal insurance, and we serve as their escape route. We are frontline, and we provide them with access. I'm proud to say that at South Central, we've tested over 4,000 patients. And our sister community health centers have tested many more thousands of them. We are managing folks via telehealth. So those who turned out positive, we have phone calls and we have video chatting, and we are helping manage them when they're at home, which relieves a lot of pressure into the hospitals, because all these patients otherwise will show up at their doors, and we know they're already filled up to the brims.
The President-elect Joe Biden made a commitment on Tuesday to the American people. Here he is. Listen to this.
One thing I promise you about my leadership during this crisis, I'm going to tell it to you straight. I'm going to tell you the truth. And here's the simple truth. Our darkest days in the battle against COVID are ahead of us.
So with a new president who is direct, blunt, honest, do you think that will move the needle and change behavior and attitudes in any way when it comes to the virus?
It does. I believe our communities, it's not that they don't want to take care of themselves. It's just they have to go out there and work. It's hard to tell someone, it's hard to tell one of my patients, look, you got to stay home for 14 days, when I know that if they don't show up to work, they're not going to earn a living. So you have to take care of the immediate, but you also have to eat. So it's very hard to ask our patients to do that, and we are understanding. Our health center is a center for education as well. So we do our best to educate our patients, but then life gets in the way. And that is the challenge. That is the challenges for people of low income and poor communities.
Dr. Jose Perez, we're out of time, but I guess there is that calculation. If you can't work, you can't eat, you're not going to live, but you take your chances with the coronavirus, I guess. That's what it comes down to sometimes. Thanks for being with us. We appreciate it.
Thank you for having me.